Hello, and welcome. Today, we're diving deep into a critical health topic: lung cancer. This disease impacts millions worldwide, and understanding its intricacies is vital for prevention, early detection, and effective treatment. We'll explore the different types of lung cancer, their causes, how they affect the body, and what we can do to fight back. So, what causes lung cancer? The primary culprit is cigarette smoking, responsible for the vast majority of cases. But it's not the only factor. Exposure to secondhand smoke, radon gas, asbestos, and other environmental pollutants can also significantly increase your risk. Genetic predisposition also plays a role. If you have a family history of lung cancer, your chances are higher, even if you've never smoked. It's also important to note that while smoking is the biggest risk factor, even people who have never smoked can develop lung cancer. Let's understand what happens inside the body when lung cancer develops. It starts with damage to the cells lining the airways in the lungs. This damage can be caused by carcinogens present in cigarette smoke or other harmful substances. Over time, these damaged cells can begin to grow uncontrollably, forming a tumor. This tumor can then invade surrounding tissues, such as the pleura, blood vessels, and lymph nodes. If the cancer cells break away from the original tumor, they can spread or metastasize to other parts of the body, like the brain, bones, and liver, creating secondary tumors. This spread is what makes lung cancer so dangerous. Lung cancer is a significant global health concern. It's one of the leading causes of cancer deaths worldwide, affecting both men and women. While smoking rates have decreased in some countries, lung cancer remains prevalent, particularly in older adults. The incidence varies geographically, influenced by factors like smoking habits, industrial pollution, and access to healthcare. Understanding the epidemiology helps us target prevention efforts and allocate resources effectively. Lung cancer often doesn't cause symptoms in its early stages. That's why early detection is so crucial. As the cancer progresses, common symptoms include a persistent cough that doesn't go away, coughing up blood or rust-colored sputum, chest pain that worsens with deep breathing or coughing, hoarseness, unexplained weight loss, loss of appetite, shortness of breath, and recurrent respiratory infections like bronchitis or pneumonia. Some people may also experience bone pain or neurological symptoms if the cancer has spread to the bones or brain. It's important to remember that these symptoms can also be caused by other conditions, but it's essential to consult a doctor if you experience any of them, especially if you're at high risk for lung cancer. Diagnosing lung cancer typically involves a combination of imaging tests and biopsies. A chest X-ray or CT scan can help visualize any abnormalities in the lungs. If a suspicious area is found, a biopsy is usually performed. This involves taking a sample of tissue from the lung to examine it under a microscope. Biopsy methods include bronchoscopy, where a thin, flexible tube with a camera is inserted into the airways, needle biopsy, where a needle is inserted through the chest wall to collect tissue, and surgical biopsy, which may be necessary in some cases. The tissue sample is then analyzed to determine if cancer cells are present and, if so, what type of lung cancer it is. Lung cancer is broadly classified into two main types: small cell lung cancer SSCLC and non-small cell lung cancer NSCLC. NSCLC is the more common, accounting for about 80 to 85% of all lung cancers. It further subdivided into adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Cell C is less common but tends to be more aggressive, growing and spreading rapidly. The classification of lung cancer is crucial because it guides treatment decisions. Treatment options for SCLC and SCLC can differ significantly. Treatment for lung cancer depends on several factors, including the type and stage of the cancer, the patient's overall health, and personal preferences. Common treatment options include surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. Surgery may be an option for early-stage NSCLC to remove the tumor. Radiation therapy uses high-energy rays to kill cancer cells. Chemotherapy uses drugs to kill cancer cells throughout the body. Targeted therapy uses drugs that specifically target certain molecules involved in cancer growth. Immunotherapy helps the body's own immune system fight cancer. Often, a combination of these treatments is used to achieve the best possible outcome. Palliative care, which focuses on relieving symptoms and improving quality of life, is also an important part of lung cancer management. Prevention is always better than cure. The most important thing you can do to prevent lung cancer is to avoid smoking. If you smoke, quitting is the best thing you can do for your health, regardless of how long you've been smoking. Avoid exposure to secondhand smoke, radon gas, and other environmental pollutants. Consider getting your home tested for radon. Eat a healthy diet rich in fruits and vegetables. Regular exercise can also help reduce your risk. If you have a family history of lung cancer or other risk factors, talk to your doctor about lung cancer screening. The prognosis for lung cancer varies depending on several factors, including the stage of the cancer at diagnosis, the type of cancer, and the patient's overall health. Early detection is key to improving outcomes. Advances in treatment, such as targeted therapy and immunotherapy, have significantly improved survival rates for some patients with advanced lung cancer. Researchers are constantly working to develop new and more effective treatments. Recent research focuses on personalized medicine, using genetic information to tailor treatment to individual patients. There is also ongoing research into new screening methods to detect lung cancer earlier, when it's more treatable. The fight against lung cancer continues, and with continued research and advancements, we can hope for even better outcomes in the future.